Hi, I'm Dr. Annalene Weston, Dentolegal consultant at Dental Protection. Welcome to Riskbites, a series of podcasts created specifically for dental practitioners in Australia. Riskbites looks at the key dentolegal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. Today, I'm talking with my colleague and fellow Dentolegal consultant, Dr. Colm Harney, about cosmetic dentistry. Hello, Colm.
Good morning, Annalene.
And I know, Colm, that you wanted to start today's episode by describing a scenario that we at Dental Protection see all too commonly, and this often leads to great distress and frustration for all parties involved.
Yes. Yeah, Annalene, this morning I'm going to start off by painting a picture drawn from a composite of cosmetic-related complaints that I've reviewed since starting work at Dental Protection. So I'm going to ask you to picture the scene. You know that your first patient of the day is a new patient, and there's a file note that they've seen social media posts about the services provided at your practice, and they want to improve the appearance of their front teeth. So the patient walks through the door, and your first impression is of an enthusiastic, well-presented person in their early 30s who advises that they're very busy and they must leave in 40 minutes to meet a client. They're getting married in 6 months. They've saved enough money to have the work done that they always wanted following relapse of crowding after teenage orthodontics. They know they don't want orthodontics again, and they've seen some before and after veneer cases on your website, which they believe closely correlates to their current situation.
Yes, Colm, I can visualise this patient and almost hear the words coming out of their mouth. While you were talking, I've run through a few things in my head, even at this early stage. So were there previous issues of compliance, for example, that may have contributed to relapse? And what expectations might this patient already be anchored to, having reviewed these perhaps more ideal cases on social media?
Yeah, all that. So looking at the curated cases on the website and the time deadline as well. So there's a few time deadlines in there. There's the 6-month time deadline of the wedding, which should be relatively comfortable. However, they've also set a scene of a busy person who's already putting time constraints on their availability even for this initial consult. However, a comprehensive examination is completed, and a clean had been carried out recently at a No Gaps clinic, and the patient brought along copies of the recent OPG and bite wings. So that saved a little bit of time. And they were otherwise dentally healthy with no previous restorations. So all quite simple so far. The diagnosis is of mild crowding in the upper anterior segment with minimal rotations and misalignment. The lower anteriors are also moderately crowded, but the patient is not interested in correcting these. So we sit down, we discuss options from doing nothing, camouflaging the misalignments with resin veneers or porcelain veneers. The dentist also discusses various orthodontic options, including clear aligners, but the patient rejects those out of hand. So start off, some extraoral, intraoral clinical photographs and a digital scan are taken. Patients booked up for a follow-up in 1 week to discuss various options once the smile design's done. The patient also takes away some education material and is directed to further information on the practice website. So, a week later, patient returns and affirms that they want to have porcelain veneers. And while they don't want that Hollywood white smile, they say, they still select a BL1 shade, as everyone else going to the wedding is having their teeth done too.
Right. I think this is a good time to step out of this scene for a moment, Colm. The reason being that we know that this area of practice is under particular scrutiny at the moment by the regulator, and that area is cosmetic dentistry. Yeah. So in a news article as far back as mid-23, AHPRA signalled that they were proposing new resources for practitioners undertaking and advertising cosmetic procedures. And these were being developed to safeguard the wider non-surgical cosmetic procedures industry. Mm-hmm. They advised the national boards, including the Dental Board of Australia, would be consulting on the new proposed guidelines. Now, this consultation was extended until the end of March last year because so many submissions were received. But at the time of recording right now, the updated guidance has not yet been released. Now, we've contacted AHPRA and they're not able to tell us what the release date will be, but trust me, our listeners, as soon as we know, we will be letting you know and explaining to you what this guidance actually means. If you are interested in finding it, if you go on the AHPRA webpage and you look for consultations, this is now sat in a past consultation on the Dental Board of Australia webpage. And once the consultation is complete, all the submissions made by interested parties, you'll be able to read them. So the proposed draft is there, and soon you'll be able to read what people said about it and what the final document is.
Yeah. So a little bit of background on what you've elaborated on. The public consultation had a declared focus on, quote, reforming the regulation of registered health practitioners who work in the non-surgical cosmetic procedure sector in Australia to improve practice and standards, to improve public safety, and provide opportunities for more informed consumer choice, end quote.
It's interesting because we don't necessarily consider teeth as being non-surgical, but we've been captured in this guidance. And
yes.
Just for clarity, surgical cosmetic procedures, that's more your breast augmentation. So that's why that line's been drawn there.
Yeah. And this process identified that the non-surgical cosmetic procedure sector has unique features that increase public risk, including a lack of clear information about the qualifications and experience of practitioners in the sector. Now, these are from the consultation papers.
Sure.
Yeah. Advertising that minimises the risk and complexity of a procedure or implies unrealistic results. High numbers of young and potentially vulnerable people seeking the procedures. Generating demand and upselling procedures and products. Financial gain competing with and sometimes outweighing patient well-being and safety, and ongoing cost and frequency of procedures required by patients to maintain outcomes. So these are the issues that AHPRA is flagging up and has identified in this non-surgical space of cosmetic procedures.
Yeah, I think it's also important to get a sense of what the regulator's looking at. So in broad terms, all dentistry should or could be considered to be cosmetic dentistry. I remember being taught the fundamentals of form and function at dental school. So what, Colm, is the scope of this actual process?
Yeah, so while the term cosmetic dentistry is hard to specifically pin down, we generally know it when we see it. And it usually shares a number of broad traits or characteristics, which we can see in this scenario too. So mostly elective treatment, driven primarily by patient wants rather than, I suppose, a more objectively clinically determined need. It's often, but not necessarily always, high value. It may be irreversible, such as any procedure where teeth are prepped or moved in the bone, however minimally. If patient want rather than necessarily objective clinical need is the primary driver, understandably, I think we see that patients have high expectations, which are often directly proportional to the costs involved. And sometimes patients overlay a degree of urgency or deadline to the request for treatment, such as a life milestone, a wedding, significant birthday, etc. So the AHPRA article states something that we as clinicians intuitively know from our training and experience. While, and this is again quote, while cosmetic dentistry can positively impact many people's lives, the Dental Board of Australia warns that procedures such as tooth veneers can be major lifelong undertakings that are not risk-free, end quote. So it goes on to say that practitioners must ensure patients are provided adequate time to properly consider the impact of cosmetic procedures, that realistic expectations are set, and that informed consent, including financial consent, is gained.
Indeed. And that can be the cost of upkeep and replacement.
Yeah, ongoing maintenance.
Sure.
Yes.
So back to the scenario column, what happened next?
Yeah, so fortunately, back to the scenario, there was a lengthy discussion in that follow-up appointment, and the practitioner addressed all questions that the patient had, including a reiteration of the time deadline. The patient took great interest in the smile design on the computer screen, and some minor amendments were made on screen to the incisal contours of the teeth by the patient. An estimate of costs was given, and the patient was prepared to pay a 20% deposit. So with that in mind, the patient was booked in 2 weeks' time to have 10 porcelain veneers done from 1.5 to 2.5. The appointment went well. Temporaries were replaced according to that modified smile design. A few further micro adjustments in contour and profile were made under direction of the patient, and then the patient was very happy. The fitting appointment was booked for 2 weeks' time, and relevant instructions were given. However, that evening, the patient DM'd the practitioner at 9:30 p.m., stating that they needed a review immediately to further adjust the central incisors that they thought were too long. Attached to that DM was a selfie with markings of the adjustments that the patient felt were required. They specified the only appointment they could attend was the next day at lunch, as they were extremely busy that week.
Of course they were. And I'm starting to get that familiar sinking feeling now, Colm.
Yes, as I think probably the practitioner was too. However, first thing in the morning, the practitioner's appointment book was rearranged to fit the patient in, and some minor adjustments were made. Patient indicated that when they brushed their teeth that morning, they really noticed the colour difference between the upper and lower teeth. They did acknowledge that it was discussed prior to treatment. However, they said it wasn't as obvious in the smile design on the screen as it was in the bright light of their bathroom. The lab work was then halted. The patient accepted an offer to go to the lab and have a review of the shade with the experienced technician overseeing the case. There were a further 4 visits for minor adjustments and to address sensitivity of a lateral incisor over the next 3 weeks. By the end, the patient did finally accept the case, and a scan of the further modified temporaries in situ was sent to the lab. The patient had also agreed on a shade with the technician, so the green light was given for the case to proceed 4 weeks after that initial prep appointment, with the patient now starting to express dissatisfaction with the additional appointments and time taken to complete the case.
How did the fitting appointment go?
So we did get the green light and the patient turned up for the fitting. So a try-in was done, and clinically everything looked to standard, with excellent margins, healthy emergence profiles, and lifelike, albeit very white shading and characterization. The patient was again under a time deadline, and they said, just go ahead, proceed with the fitting, as they needed to rush off to a meeting. Everything proceeded to plan, and before the clinician could get those final clinical photos, the patient said they had to leave as they were now late for the meeting. They also didn't stop at reception to pay the final instalment of fees. So a TLC call was made the next day, as was routine practice. It went to voicemail, and all further attempts to contact the patient by phone and email went unanswered. The next contact with the practice was a letter of complaint 4 weeks later, expressing how unhappy the patient was with the final outcome. They said the teeth were thicker than their original teeth and the colour was not right, without giving any further information. They said they were developing anxiety about meeting clients and it was affecting their business. They demanded a full refund of fees and said they had lost confidence in the practice due to the amount of time and visits taken to get things right, and they were still unhappy. At this point, the exasperated and frankly blindsided practitioner reached out to Dental Protection for assistance.
This scenario taps into so many aspects of care that we see in these so-called cosmetic complaints, and objectively, we can see what's happening. The practitioner's often carrying out all of the clinical dentistry to standard, but maybe paying less attention to some other aspects of the patient care.
Yeah, definitely. There's certainly a number of time-worn mantras that we trot out at Dental Protection that might apply here. First of all, being never treat a stranger. It always pays dividends to get to know your patient and all their little habits, quirks, and nuances to determine if you are the right fit for each other before embarking on big cases. Many of these cases often share a number of key characteristics or traits, such as lack of alignment between the patient expectation and the treatment outcome. This may be slowly evolving through the process, such as those multiple try-ins, never quite satisfied, Or it may come as a surprise at the end when everything is complete and bonded in place. There may be dispute over finances, such as who covers the costs for any modifications, redos, variations, and sometimes there's a refusal to pay a final instalment. There can be time blowout, which may be due to patient factors, such as those multiple try-ins, or it may even be biologically driven, such as slow or unpredictable tooth movement in a clear aligner case. And last but not least, there can be allegations of seemingly disproportionate levels of dissatisfaction. I can't go out anymore. I can't smile in photos anymore. My bite has changed and I can't eat properly. Or you've ruined my life.
Indeed. And what's also interesting in many of these cases, Colm, when they're reviewed by an expert, there is often very little objective evidence to say the work is significantly below standard.
Yeah, indeed, that's often the case. The issues that surface time and time again, however, are the same issues that the board are reviewing. Consent, record keeping, which are both inextricably linked. With regard to consent, it's interesting to note that the board is also urging patients to consider a number of key questions to help them when considering any cosmetic dental procedure. So again, this comes from the board's literature. The patient should be asking the questions, why do I want to have the procedure, and am I willing to accept the risk that I might be unhappy with the outcome? What are all the health, financial and other risks of the procedure? Is this procedure an irreversible and lifelong change that will require ongoing care, maintenance and possible replacement, incurring additional future costs? What are the realistic expectations I can have for this procedure and what are the alternatives? Has the practitioner explained the procedure and do I understand it? Should I seek a second opinion? Have I discussed this with my usual treating dentist who maybe I trust and have a long-term relationship with? Do I need to be referred to a specialist for any part of my treatment? And do I need time to think about this process before I commit to what may be a lifelong change? So these are all the questions that the board is urging the patients to consider before embarking on these non-surgical cosmetic procedures. So practitioners are also encouraged to use the self-assessment tool on AHPRA's advertising hub to ensure that their advertising complies with the national law, because this feeds into this as well, Annalene.
Absolutely. It's another trap. Mm-hmm. So what about their records then, Colm?
Yeah. And of course, when it comes to record keeping, setting aside any omissions related to clinical care that may not be to standard, all relevant aspects of the initial assessment, discussions, or mutually understood consent, including finances and ongoing maintenance needs, must be comprehensively documented to the standard required.
Yeah, and that's a must that we're seeing more and more prevalent in complaints, as in something that the regulator is noting more and more when they're responding to complaints. Now, this whole discussion, Colm, also brings into mind aspects of other dental protection podcasts, such as How to Say No. And we did a podcast on body dysmorphia as well. So we can, of course, provide links to these episodes in the episode notes, as well as all of the resources and references that you and I have been touching on as we've moved through this podcast.
Yeah. So, thanks for that. And to summarize, cosmetic dentistry is certainly an area that's coming under increased scrutiny by our regulator and also in the media and the consciousness of the public. It's important to note that in this area of dentistry, practitioners are not just being scrutinized for their standard of care, but also patient selection, consent, advertising, working within scope of practice, maintenance, and the quality of how all aspects of the case are documented.
Yep. So watch this space. Once the new guidelines come out, as I said, we're going to provide a comprehensive update as promptly as we can on what they mean and how it might impact on dental practice in the future. And as always, if you need any advice from us, we're just a phone call away. So thank you so much, Colm, and thank you all for listening. And we do hope this podcast was helpful to you. And we look forward to sharing more guidance with you in the future, maybe about these updated guidelines. Hey, So if you like dental protection podcasts and you'd like to hear more, please subscribe and leave a review.